Hello, future doctors. I'm Dr. Salam Hamdi, anesthesiologist intensivist at Sahlul Academic Hospital, associate professor in anesthesiology and intensive care, affiliated to the Faculty of Medicine of SUS. Today, in this short video, we will see that capnography doesn't reflect only ventilation. It can reflect circulation and metabolism. That's why I entitled this video Capnography Beyond Breath. We all know that capnography is a monitor of ventilation, and everyone knows that when the end tidal carbon dioxide is high, we are in front of a patient with hypoventilation, and when the end tidal carbon dioxide is low, we are in front of a patient with hyperventilation. But is this all what capnography can inform us about our patients? The response to the previous question is no, meaning that capnography doesn't reflect ventilation only. It reflects also circulation and metabolism. First, we have to know that carbon dioxide is produced in cells, carried by the blood from tissues to the lungs, and if circulation drops, as in shock or cardiac arrest, less carbon dioxide reaches the lungs, therefore less carbon dioxide to be exhaled. Another example to show that capnography doesn't reflect only ventilation is the fatal complication that we can see rarely in anesthesia, which is the malignant hyperthermia, which is a life-threatening condition caused by exposure to certain drugs in genetically predisposed patients. In this condition, a rapid sustained rise in end-tidal CO2 is often the earliest and the most sensitive sign. So to recapitulate, capnography doesn't reflect only the ventilation, it reflects circulation and metabolism. So look at the number of the end tidal carbon dioxide, and if your parameter of ventilation was not changed, think that it might be a problem in circulation or in metabolism. Again, and to emphasize that capnography doesn't reflect only ventilation. As you can see in cardiac arrest, the end tidal carbon dioxide drops sharply because of the poor circulation, even there is no circulation. Muscle pulmonary embolism, the end tidal carbon dioxide drops because less blood flow to the lungs. In hypovolemia, hemorrhagic shock, early subtle end tidal CO2 decrease before blood pressure drops. So it is an early sign. In malignant hyperthermia, an unexpected rapid rise in end tidal CO2 is widely recognized as the earliest and most sensitive clinical sign. So in short, capnography reflects ventilation, perfusion, and metabolism. In conclusion, the takeaway messages: always interpret end tidal carbon dioxide in context, ventilation changes, circulation changes, or metabolic status. Second, capnography can give earlier warning of circulatory compromise than blood pressure alone. Third, continuous end tidal carbon dioxide monitoring is essential in anesthesia, intensive care, and cardiopulmonary resuscitation. Thank you, and see you in next videos from this series of educational medical videos.